Welcome to the Susan Brender Show. It's all about you. Featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. I am so pleased to have Amy Dayries on my show again. She is an author of a very interesting book called Solve Your Sleep for Better Health, Get to the Care of Your Snore. Now, that is get to the care of your snore. That just sounds really funny because I guess most people snore, but they don't even think about it. And you're writing about it, and I think it's really interesting. Now, you're a dentist and a spokeswoman for the American Dental Association. You're a mom, and you're an entrepreneur. Wow, I'm just getting tired thinking about all those different things. Now, you have researched proven ways to impact your chances for a better night's sleep. Over half of Americans do not sleep well at night. And I'm sure everybody can relate to that because sleep is a very serious issue in this country and all over the world. People have problems sleeping. Now, you also say that many parents do not know the links between ADD and ADHD and sleep issues in kids as well, which I really, when we spoke about it, I did a little research and I was so surprised to find out that this is an issue for kids. I never thought kids would be involved in something like this. Well, anyway, now I have given your bio and people know a little bit about you. So what I want you to do, Amy, if you would, is tell people about your book one more time, and then let's go a little deeper into some of the things that are in your book so that people can understand how you are such an interesting dentist, because most dentists, you go into their office, they clean your teeth, they give you a little bit of a change in your enamel and, cavities and that sort of thing, but look at what you're doing. So, Amy, why don't you tell our audience a little bit about your book again?
Sure. Thank you, Susan, for having me on your show again. So the book is called Solve Your Sleep for Better Health, Get to the Core of Your Snore, and it delves into, each chapter takes a different aspect on about how to solve your sleep. So there is a chapter on using different herbal supplements that have been medically proven to help with sleep. There's another chapter on using vitamins. There are certain vitamins that are directly, and minerals too, that are directly going to influence how well, how deep you sleep, how much REM you sleep or have when you sleep. REM is your deepest sleep, where you might dream. Then there's another chapter on connections with sleep and inflammation and obesity. And then we go into describing how different gene systems, gene SNPs, can be turned on by your lifestyle choices and also impact sleep, as well as concussions, how those can impact your sleep and what to do about it. And then there's a whole new generation of dental oral appliances that can take the place for a lot of people of the CPAP machine, which for about the last 20 years has been our go-to in this country. When people have sleep apnea, they think they need to wear a CPAP machine, which is kind of like an air hose that blows air constantly down into your lungs. But it's not actually changing how your body is if there were some pre-existing conditions of your body, whereas these oral appliances can actually address and help remodel the airway so that you can sleep easier.
Yeah. Amy, you mentioned the word obesity, and obesity is a major problem in this country. When I say major, I really mean it because look around. I mean, see what people are eating, which is a description of why they're, obese. But you said that your situation, you understand obesity and you understand how to take care of it. Now, tell our audience about that.
Okay, wow, that's a big topic. I could do a whole 2-hour lecture on that, actually. So for starters, one of the paradigms that I think we're going to see have to change in the field of healthcare is since World War II, we have relied heavily on antibiotics to fix different types of diseases. And you might say, well, what does antibiotics have to do with obesity? And the answer is a great amount. There was a study done a number of years back, and out of the study came this idea. They call it the old friends hypothesis. I think Charles Murad was the scientist behind this hypothesis, and it was found that our gut microbiome, the bacteria that live in our gut, directly influence how we store fat. And when we've exposed ourselves to antibiotics, and in some cases that's medically absolutely necessary, but in other cases it's sort of elective, like I think I'm getting a sore throat, I think I should go get antibiotics for my doctor to get well, but no one's doing testing to see if you really have to have the antibiotics, that you've decided that that's the route that is going to make you well. What you may not understand is you're killing off this microbiome, these old friends, these bacteria that have existed inside us for millennia, and it takes us years to regenerate those bacteria in our gut and in intestines, in our mouths, and in that interim, while we're rebuilding this bacteria kingdom inside of us, we're more susceptible to diseases, to other colds, other infections, but we also are getting repopulated. It's like a race to the fittest. Who can populate you the fastest? And a lot of times it's these different types of bacteria that cause cavities in terms of dentistry or gum disease, but also those that cause obesity. They will influence how we think and influence rates of depression, and also how we store fat. So we want to, I think that's why we're going to see this paradigm changing over time. Plus, we don't have as many antibiotics in our development pipeline. We're running out of antibiotic choices. So you're going to see doctors becoming more picky about who gets them and who doesn't.
I'm curious about this, Amy. There are so many doctors who would never give out that information. All they do is they put you in their chair and they take care of you and they say, let's get some of the money paid for this particular procedure, but they don't really get into some of the options that you have and some of the realities that you face when you do take antibiotics. So I'm curious why that is not the way dentists or doctors treat people. Why don't they give them the information?
Well, sometimes it's a matter of, are you still interested in continuing to learn? So the way I was taught in school, and I graduated in the mid-1990s, we were taught you absolutely always write a prescription for antibiotics for certain types of problems. And some dentists might still do that as we were taught. But if you continue to have a curiosity and a desire to learn, and you don't mind being sort of a thinker, a lot of times you can find that these things become an unnecessary activity if you're addressing the cause of a problem. And if if you don't mind really going that a little bit extra mile, sometimes when it might be inconvenient, like coming in after hours to treat a toothache, or being firm on different other policies, like you need to get this other treatment done right now so you avoid the risk of needing antibiotics.
I understand what you're saying, and it really makes a lot of sense. Now, your book explores, as you said before in your bio, a lot of different topics, and you talk about hormones, herbal remedies, anti-inflammatory diets, vitamins, and supplements. Now, I was led to believe that vitamins and supplements really don't do that much. Somebody said that you take them in and they just go right out. Now, obviously, you don't agree with me, do you?
I do not agree. Now, the quality of the supplement, the form of the supplement, can definitely make a difference. And that's where these things called gene SNPs can come in terms of the form of the supplement. So, for example, if you have an older, maybe more than 5 years ago, version of the 23andMe genetic testing, you would have gotten back a report on what gene SNPs you might carry. And that's how we came across these gene SNPs, was through the Human Genome Project. So what a gene SNP is, it's where your lifestyle choices, maybe not working out, see sitting around more, sedentary lifestyle, or a lot of stress, can upregulate or sort of enhance the turning on of a gene that's in your DNA where you don't absorb things as well. And these can impact metabolic hormone cycles or enzyme cycles. So, for example, somebody, with mother-father gene SNP, if they are homozygous for that, which means they got the gene from both parents, they are not able to absorb folic acid or vitamin B12 very easily. So they could eat a wonderful, healthy, nutritious diet, maybe a big spinach salad, but they may only absorb 20% of the folic acid and the vitamin B12 in there. So circling back around to hormones and supplements, those people that would have that particular gene SNP, if they know it, then when they go to buy a vitamin supplement, like a vitamin B complex, they're going to want to purchase one that has methylated folic acid, or they call it methylfolate sometimes,
right,
or a methylcobalamin, or a methylated form of vitamin B12, because they're not making enough enzyme to methylate these two vitamin forms. And then you extrapolate that into other types of hormones. When you don't have some of these basic vitamin levels at sufficient vitamins at sufficient levels, you're not able to turn some of these other metabolic cycles in an efficient sort of way. So you experience more fatigue, you just feel more drained, you're more run down. And then you couple that with these other hormones. For instance, when women go through menopause,
right,
our tissues become more saggy, like in our airway. So, and progesterone, we know that progesterone, women's hormone, stabilizes breathing while we sleep through increasing the urge to breathe. It tells you to breathe. But when we don't have that, we are more likely to have a collapsing airway or snoring that can happen. So knowing where you stand with your different levels, there's progesterone testing that can be done with salivary testing, and then how you want to address that with your doctor. See, not everything is by the dentist, of course. That can also help with your sleep.
Yeah, you just mentioned the word snoring again, and a lot of people are, it's mostly older people, are dealing with that sleep apnea. And it's scary for them because their heart stops, literally. Now, you said that there are new appliances for that. Am I correct? And if there are, can you tell our audience a little bit about those, if you will?
Oh, sure, I'd love to. That's become one of my passions in my dental practice, is making a lot of these appliances for people. And there's many different ones. So for starters, the CPAP doesn't work very well in some people. It has been, in some cases, the only thing we had in terms of solutions for people that had sleep apnea. But contraindications for using the CPAP would include people that have a lot of respiratory secretions, people who have regular asthma type attacks. They have severe nausea frequently with vomiting. They have had gastric surgery, to reduce weight, or they've had a history of facial or esophageal surgery. Sometimes their reflexes aren't the same in their muscle tissues after they've had these types of surgeries. If they've had trauma or burns involving the face, or if they have unstable cardiorespiratory status, or just trouble with regular breathing. Unstable cardiovascular status, that might be like COPD.
Right.
People with a lot of anxiety where they get panic attacks. So these people don't do well with CPAP, and that was our only option. And so we needed more other options for some of those other types of people. So that's where oral appliance therapy comes in. And we can measure nowadays in a dental office on a cone beam x-ray. It's also called a CBCT x-ray. You can measure the size of the airway and get from that, glean an indication of if that person's trying to breathe through a coffee straw or are they breathing through a garden hose. And ideally, you want to have the option of breathing through a garden hose, because let's say you have a coffee straw as an airway, a coffee straw sized airway, and you have a CPAP machine. you're just blowing air down a teeny little narrow tube, and some air gets to your lungs, but you still aren't working as well as you could. And that's why if you have asthma where you have constrictions in the bronchial tubes and you already just have a coffee straw in other parts of the airway, you're at a high risk to have a serious problem develop. Yeah, we can measure the airway, and then the oral appliances, some of them bring the lower jaw forward, and others can remodel the airway. These are FDA approved to do that, and one is called the Vivos appliance, VIVOS, and they and some of those are made to bring the lower jaw forward, but they actually will expand the palate, and in doing so, if the airway is crimped behind where the teeth are in what is called the oral pharynx, the upper part of the airway, it can actually volumetrically expand it.
Right. You are called an entrepreneur as well as an author and as well as a dentist. As an entrepreneur, do you have any patents on those different appliances?
No, I do not. I have nothing financially to disclose about this. I am simply a user of things people have patented, other people have patented. I do not own any stock in any of these companies. I just use them, and I see that they work on my patients. They feel better, and that's enough for me. My business is taking care of the patient.
I understand. And so as you talk about all these different appliances and different diseases and different problems that people will face, it seems to me that you've done a lot of research and you've done a lot of work to find out about all these different things that help your patients. Are you unique in that?
I might be unique. That's one of the reasons I wrote this book, because I want more people to have access to the information and have one place where they can try, and that's the book, where they have a game plan for trying a whole bunch of different things.
That's admirable, Amy. I really think it is. Now let's get back to the work that you do with kids and the thoughts that you have about how they can be better off when they get older, because they're following some of the rules and the regulations that you kind of set before them and give their parents. So, okay, give me a scenario. A kid walks into your office and you're about to look in his mouth. What do you give us an idea of the process?
Okay. Well, I visually just look at the patient first, and I read over their medical history. So things that really catch my eye and make me wonder, I wonder if this child has trouble sleeping, would include a history of a lot of ear infections, ADHD or ADD, attention deficit disorder, or focus issues, dark circles under the eyes, and or maybe the whites of the eyes showing above or below the iris, which is that colored part of your eye, having crooked teeth and a V-shaped arch or dental arch, where instead of the teeth being shaped in like a wide letter U, they're more in like a letter V, maybe a history of thumb sucking, having a history of a birth trauma when they were born, or maybe they fell out of their high chair, so they've had a head trauma or suffered a broken nose as a young child, poor eyesight, thumb sucking, I might have already said that, mouth breathing, allergies, eczema, and a chronically stuffy nose, daytime tiredness, maybe really bad breath. If they're snoring, kids should never snore. Bedwetting is another really common sign of these kids. So they don't have to have all these symptoms, but if they have a few of them, you start to see sort of a pattern. And then you look in their mouth. So some of the things I just mentioned are what you see externally or what you read on a medical history sheet, like they've had chronic ear infections, and other things you start looking at inside the mouth. What we know is also if they have a tongue thrust, which means their tongue is coming forward and downward, and they're pressing their tongue behind or in front of or between their front teeth when they're speaking or swallowing. That's another symptom of this thing called a tongue thrust, which means that they're going to be ramping up or turning on their sympathetic nervous system, because you see that the tongue is the only muscle that's in the midline. Every other muscle in your body is either on the left side or the right side of the body, so they're only innervated by one side of the brain. But the tongue is different. It's in the middle of the body, and it's innervated by both sides of the brain. And one of the nerves that goes to your tongue is the vagus nerve, or the tenth cranial nerve, which also innervates your heart, your brainstem. It's the nerve that tells you to have hiccups. It's the nerve that makes you feel nausea when you feel nervous or sick. And this vagus nerve, when the tongue is down, it's turning it on, which is also going to stimulate it in other aspects. So people have more anxiety. They have less of a heart rate variability. So if they go work out, they have less room to have the heart rate escalate because it's already overworking a little.
Let me interrupt you for a second, Amy. When should a parent bring in a child to see you? What age is very important for a kid to just be diagnosed, or at least have an opportunity to kind of avoid certain problems that you have suggested?
I would say very young. I used to tell people not to try to bring their child in for a regular dental checkup till maybe age 4. But if your child had a birth trauma, they are beginning to check this more and more in delivery rooms. As they did historically, they would, if they saw a tongue tie or there was a lot of birth trauma, they would check for a tongue tie and even adjust the patient in the hospital delivery room. But I would say if you suspect your child, your baby, I see infants sometimes too, has a tongue tie, that would be grounds to come see me or a dentist in your area to have it evaluated to see if you need it clipped. It's a very general process for a baby, and if they're having trouble nursing, that would be a big clue. Or they're super picky eaters, that would be another big clue.
It sounds like your book deals with quite a bit, but if you had a chance again to write a book about kids, because kids are our future, and we want our kids to be healthy. So how would you attempt to, or what, rather than not attempt, but rather to say to the parent, because the parent is the one who's going to read the book, what would you tell them in the beginning of the book just so that they really get, kind of get in and really say, I got to read this?
One of the best things a parent can create for their child is a situation where the child is best assured that they can potentially obtain a wonderful night's sleep. So if you're noticing your child breathing through their mouth, you have concerns about whether they're tongue-tied or being able to eat well, they have chronic allergies, they have asthma, if they start developing focus issues, they've had birth trauma, please get them to be evaluated by a dentist, because the dentist is uniquely positioned to help take care of certain sleep problems that can originate from oral health.
Are you connected to a pediatric doc who will send people to your office? Because that seems to be a very good connection.
It is a good connection, and I do work with somebody like that.
Terrific.
Yes, I do.
Okay, now we're almost at the end of the show, and there's so many different things that we haven't covered. I want to know, from your standpoint, what is something that our audience ought to know about that we haven't covered in this second show that we're doing?
Well, I would really say just developing an awareness that you don't have to be resigned to using a CPAP if you're an adult, that there's other appliances available to people that can help remodel things and kind of graduate you because you're addressing the cause of your sleep problem, which is a crimped airway. And also, if you are seeking out orthodontic care, braces, at any age, I would also really like to ask that you have your orthodontist or your dentist, whoever is doing the care, ask that they are evaluating your airway in the process to make sure that that nothing is happening where your airway could possibly become compromised. So what we're seeing with that is we are moving away from doing extraction of some of the permanent teeth to make space to uncrowd the other teeth. We really want to stop extracting permanent teeth for the sake of straightening the other teeth. There's ways around growing the jaw so that you can accommodate and have room for these permanent teeth, and even wisdom teeth if you start early enough.
Amazing. Amy, for people who are not able to pay for a dentist because, as you know, it's not cheap to go to a dentist, and they don't have necessarily the resources to pay. And sometimes they put that on the back burner because other things take the place. So what can they do?
All right. Two suggestions. In your area, you may find that there are clinics for indigent type care, for people that need help, financial assistance, or a dentist that might offer care on a sliding financial scale. So, for example, in the Atlanta area, we have two clinics. One is called the Good Samaritan Dental Clinic. The other is associated with Grady Hospital. It's called the Ben Massal Dental Clinic. The second thing I would recommend is look for foods for your young children that are crunchy, things like beef jerky, where they're going to have to really exercise their teeth. The muscles that help them chew get a workout, which is going to stimulate bone growth and a broadening of the occlusal or the arch, the dental arch, which is going to help improve the airway growing. And there is an over-the-counter product people can purchase. I love this product. It's called the Mayo Munchie. It is out of Australia, but it can be ordered on the internet, and it can also be used to stimulate the dental arch, and it's offered at around, there's a range, probably $120 US, and it can do a lot in terms of straightening teeth. Yeah, so that's pretty inexpensive in terms of creating a situation that can benefit somebody for their entire life.
Yeah, considering what it does, from your standpoint, it sounds like it is a bargain. So I want to, again, ask you to tell the people the name of the book, how they get your book, and do you have any books coming up?
Any other books coming up?
Correct.
I don't have a second one out yet, but I am starting to work on one, and it's going to, again, sort of connect oral health with the overall health of the body. I don't have a title for it yet. But my current book, Solve Your Sleep for Better Health, Get to the Core of Your Snore, it is available on Amazon Kindle right now. And my name is Dr. Amy Dayries. I'm a dentist, D.M.D. So Solve Your Sleep for Better Health, you can find it by Googling that on Amazon Kindle. It will be in print, hopefully by around the holidays, and this is the year 2019. So in a few months, it will be available in print.
Well, you are always a great guest, Amy, because the amount of information that you have is just incredible. I mean, if you didn't tell me you were a dentist, I would say that you have all the credentials of a doctor as well, an internist or any kind of doctor. But I really, really want people to get the book because I think that health is the number one issue that people have to deal with, whether it's a kid or whether it's an adult. These are the issues in your book that help you find ways to really be more comfortable and healthy. So with that said, Amy Dayries, it's a pleasure to have you on the Susan Brender Show, and I look forward in the future to interviewing you when the next book comes out. So thank you again for being on the Susan Brender Show.
Susan Brender, thank you so much. I really appreciate you letting me come on and talk about my book and these things near and dear to my heart. Thank you again.
Thank you.
Thank you for listening to The Susan Brender Show. To be a guest, email sebrender@yahoo.com.